We are talking about how to become a radiologic technologist. This is my first time going live. I'm actually doing this while I'm making breakfast. So let's talk. How do you become a radiologic technologist? Really simple and easy. You first want to make sure you do a shadow. Shadow programs that have radiologic technology. Shadow programs that have a radiology technology program, and that's going to be important because not everyone really knows what it is that we do and aren't sure. So how do you become sure, and how do you make sure that this is something that you'll be happy doing? That's the one thing I would say a lot of people, misconceptions about our profession is that people really just don't know what it is that we do, and they get into it and they think, oh, this is going to be so easy. I just get to press buttons. I get to press buttons all day, and I just get to sit there and not have to do a whole bunch. This is going to be so easy. Well, let me tell you, radiologic technology is not, again, some side hustle in healthcare. We actually make up 10 to 20% of the hospital's income and revenue. Yeah, a lot of people don't know that. But we make up a large portion. All of this came out of my garden, by the way. We make up a large portion of healthcare's income. And that's important to know because when you understand the value you give to a profession, you're better able to negotiate what you feel you're worth, be able to really not get burned out and feel like, oh, there's no growth within my profession. When actually there is. I hear people say, and not all the time, but I hear people say, oh, there's no growth in radiology. It's a boring profession. Go be this, go be that, go do this. Or I'll see students actually get into radiology. I'm trying to make a smoothie and an egg this morning. But I'll see people get into it and then they're like, oh, they listen to other people who are not even in our field talk about how limited radiology is, how there's no growth in radiology, and they work somewhere else. They're not even in our profession, but yet they affect the mind of some people in our profession who haven't been in our profession long, and they say, oh, well, I'm going to go leave, and nothing wrong if you want to go be a PA, totally fine, but don't make your reason for leaving radiology because you felt there was no growth and create this false narrative that there's not growth in radiology. There definitely is. Way more growth than you probably even know that you have. So think about this. If you went into radiology and you did the shadowing first, which is, I highly suggest you shadow the radiology departments to make sure this is something you want to do. Because when I got into it, all I knew was the x-ray part. 22 years later, I'm learning, wow, there's so many other things we do. Medical dosimetry, the education portion. The leadership is more than just being a manager at somebody's job. Nothing wrong with that. But there's more to what we do than being management. But what are some of the things that we do? We have opportunities to actually go into what we call a RA, which is a radiologist assistant. It's very similar to PA. So the physician assistant, it's tight to get off. A physician assistant actually supports physicians of each kind. So sometimes they'll support orthopedic doctors. Other times they'll support gastroenterologists. PA does not support every doctor. They have a specialty. So the same with us. We support radiologists. As a radiologic technologist, you go to school for that first, and then you support your radiologist. You support a radiologist by putting in ports, feeding tubes, PICC lines. You work in the barium enemas. You do barium swallows, fluoroscopy studies, things that a radiologist would do. So you free the radiologist up. And that is pretty much it. I mean, it's an amazing field. It actually is a 6-figure income field. It's a master degree level program. Yep. A lot of people don't know that, but it's a master degree program. So you have the opportunity to increase your education because entry level into radiology is a minimum of an associate's degree. And again, there are radiology programs out there that are bachelor's programs. But just like nursing, some people say, well, to be a nurse, you have to have a bachelor's. No, you don't. Most nursing programs are associates, ADN, ASN programs. And then they go back to get their bachelor's. It's called a bridge program. Well, radiology, we have bridge programs as well, which is encouraging individuals to elevate their education. So maybe you cannot get into a bachelor's program, but there are opportunities to bridge over into a bachelor's. But the world is changing. Levels of education. When I first started radiology, you didn't have to go to a degree program. There were hospital-based programs that offer certificates. Before me, people learned things on the job. Nurses learned on the job. Respiratory therapists learned on it. Many people in healthcare did not have to go to college back in the day, and it wasn't that long ago. Again, things change, progression happens, more education is required to hold licenses in these particular medical professions, radiology in particular. So now you have to have an associate's to practice legally. And then you can bridge over to others. You have, for me to invest in my education, it needs to pay me back. And that's what I have found in radiology. The certifications have paid me back greatly in my salary. Now, this is how you are going to take radiology and make more money. If you go to school, they have programs now where you can go straight into radiation therapy, radiology technology, nuclear medicine, ultrasound, or MRI. Those are 5 things you can go directly into without going to x-ray school first, radiology technology school first. You can go directly into one of those. Now, this is what I would say. If you're trying to make the most money, the reason I say go to radiology technology school first, not to knock any of the other pathways, not to tell you that's the only way, no. If you go into any of those other pathways, that's all you're going to be able to do. Whereas if you go for radiologic technology, everything's open to you. Because I went to school, because I went to school for radiologic technology, I can go directly into a radiation therapy program with the 1-year bridge over program. I can go to ultrasound 1. I could have 11 certifications in 11 years. I've been doing it 22 years. I could have had all certifications behind my name. I chose to get a few and master those and then bridge through those. So through CT and MRI, I got those certifications. I was able to learn clinical applications, which was a great career that I did for several years until the pandemic came. And I've been asked to do it again, I just don't want to travel. And I'm focusing in on content creation, medical content creation, and making this a business, as well as contracting work where I still scan. That's my passion right now. And that's what I plan to stick to. It allows me to be home. It allows me to, after 22 years, be able to not physically work so hard. And to kind of enjoy things like this, making breakfast. Working in healthcare, you do have to get up early sometimes. Sometimes you got to be at home late. And that does, after a while, you're like, I'd rather have a little change of pace. So the certifications for me within themselves gave me opportunity to increase, because then I went to be a travel technologist. I contracted myself out. I did clinical applications just in those 3 modalities, because I also did clinical applications in x-ray. So these are all options, even within modalities. Don't zero in yourself to just patient care. Look for ways in your modality you're doing that you can parlay that into doing something else. There are so many options out there, and they may not be advertised. So the thing you want to make sure you do is network. Networking is key. If you don't know anybody, you don't know about those jobs that nobody's posting. They're not posting them yet because they got a friend that's got a friend that's got a friend that can do that job. And they rather give it to somebody they know, or somebody that was referred to them, if that makes sense, versus having to get somebody off the street. They don't work out, the personalities, just things like that. So that's why I say networking is another way to increase your income. If you know people and they know you, and not just we work together, but knowing people and giving value to people, they want to give you value back. They want to say, let's help so-and-so, they're working hard. That's how things a lot of times work. So what else? The other thing is, if you are looking to bridge over into radiology, into another profession in radiology, excuse me, what I would encourage you to do, oh, the battery stopped in here. I hate this when this happens. What I would encourage you to do if you are a student is join organizations like your local radiologic society. If you're not part of that society as a student, make sure you join. The other thing is, if you are a rad tech and you're not part of your society yet, why not? I would join. I would say don't get into what people say as far as, well, what is the society doing for me? But just think about this. If I'm there, one meeting a month, I get to meet people. It might be somebody on that Zoom meeting that you went to for the association. They're meeting once a quarter. You met somebody on that Zoom meeting and you're like, wow, they're really cool. You met somebody sitting down next to them and you're like, oh, wow, we worked at the same place years ago. Oh, my goodness. Okay, wow, really cool. I forgot about them. I didn't remember them, but they remembered you. And they said, oh, like I'll give you this. I just got a message in my DM on Instagram. Somebody in the same city I'm in. Never knew her. She said, I'm getting ready to leave my job. It's a really good job. If you know anybody that's looking for this, send them my way. Here's the information. Like, wow. I knew somebody that I had worked with. They were done pretty dirty at another job. And they're doing fine, but they were looking for something a little more steady. This job that she told me about is exactly fits right in with what this person is looking for. Gave her a call, gave her information, setting up an interview. This is why it's good to kind of know people and have good relationships with people. Because when you don't, you struggle unnecessarily. And to other people struggling, there are people out there that want to have people with these jobs that they don't have to worry about. It's like, if you can find somebody that can take this job and we don't have to worry, they're a good worker, there's somebody that comes to work, they don't bother anybody, slowly cook. They don't bother anybody, and you refer them, okay, you're a good person, you refer them, let's go ahead with them. It saves a lot of headache, a lot of downtime for these offices, because now they've got people in a job that they didn't even have to do interviews, really interview hard for. They didn't have to do a whole bunch. That saves a lot of headache. So I hope these tips were helpful. I know there's a lot going on with me cooking breakfast. The next time I try to just sit still, but I hope this was helpful. I wanted to at least go live here to let you guys know ways that you can elevate your income. Just simple ways. A lot of times people say, well, you have to go back to college to do it. That will help elevate it. I did mention that earlier. Elevating by adding to your degree is very helpful. That can allow you to do things to where not having a degree will hold you back, or having a certain level of a degree will hold you back. There are some jobs, I always tell the story, you think to be an educator, you have to have a bachelor's degree at a minimum. If you're teaching, it depends on what program you're teaching. If you're teaching a certification program, you just have to have higher than what your students have, or at the same level. I had an associate's degree and I was an educator for 7 years. It was an associate's degree program. I couldn't be a department head or a director or a chair, because there were people who had PhDs and masters in education who were more qualified. So I had an instructor's position, which was fine. But it goes to the point of, if I would have had a higher degree, I would have made more money. So but I mean, it wasn't bad with what I was making, but I would have made more money if I had a higher degree. They paid more, whatever level of degree you had. It wasn't a whole lot more, I'll say, but it was more. So your education level, you can always add. Don't let that hold you back from going into a radiology program that is an associate's program. Majority programs in health healthcare outside of being a doctor, a physician's assistant, a nurse practitioner, a nurse, respiratory therapy, surgical tech. Everybody starts at dental hygienist, 2 years. You can bridge over to a 4-year, which is definitely a great idea. So if you want to know what schools are good schools, let me know in the comments. Come back and comment. Let me know if I can give you any tips on schools or what to look at. I actually have a video of what schools you may want to look for when you are trying to decide what school. So check out that video. Let me know what you guys think. And until next time.